Tell me about a time you've had to deal with someone really angry.
I'd probably been working in pharmacy for a couple of weeks, and this was when codeine still came in the cold and flu tablets, and you would get the serial people that would come in every Thursday night just before you close. So it was like 8:30, and these people walk in and pretend they're unwell, or they come in with someone else's driver's license, which is really interesting. And this lady was so angry because I had taken her driver's license, went up, spoke to the pharmacist, and I think the box of cold and flu tablets lasts like 4 days if you take them regularly. And it had only been 2 days since she'd been in. So 16-year-old me had to go down and tell her that I'm really sorry. Unfortunately, we can't give it to you. And she was ropeable. Anyway, she slapped the desk. I remember she snatched her driver's license back and she just walked arms out down the first aid aisle with all of the individual dressings. And she just walked arms out down the first aid aisle and just knocked every single one over. So I think there was like thousands of dressings all over the ground. And I'm just like,
This is before closing on Thursday night.
yep. I
How
think
long
it was
did that
like
take?
9:15 on a Thursday night. So we just picked them all up and put them in a pile. And until the Saturday rolled around, if people needed dressings, we just had to go through the shopping bag and find what they needed because that was a lot of sorting.
Welcome to Inside the Shoulder. I'm Kenneth Cutbush and today I'm joined by Terri-Lyn Bailey. Terri-Lyn started at 16 behind a pharmacy counter in Bundaberg. No connections, no shortcuts, just a young woman who decided the most important thing she could do was show up and actually care. 20 years on, she's been the calm voice for thousands of people on their worst days. Patients anxious, worried about seeing a surgeon, concerned about the thought of having an operation, they find themselves trusting her. Surgeons hand her the keys to everything and completely trust her. She has held it all together quietly, without credit, without fuss. She's never sought the spotlight. Today we're going to change that. Terri-Lyn, welcome to Inside the Shoulder.
Hi, how are you?
Good. So what was it like starting work at 16 in Bundaberg in a pharmacy?
It was very interesting. There's a lot of different characters that are around in a pharmacy, especially late Thursday nights and Saturdays. When I started in pharmacy, there was no such thing as Sunday trading in Bundaberg. So there was Thursdays after school. So it was, I think, like a 4:30 till 9 o'clock shift. And then on Saturday, it was 8:30 till 4:30. And that was my life from, when I was in grade 11 to end of grade 12. But in terms of working and things like that, it's a lot of responsibility to take on as a 16-year-old, especially when you're telling people twice your age about medication and all of that kind of thing. And especially like a lot of my friends worked at Woolworths or, I don't know, like fast food chains and that kind of stuff. And just the different responsibility in pharmacy work versus fast food or Woolworths and that kind of thing.
Was there ever a moment you remember where that responsibility of advising people about their medications sort of made you think, gee, what am I doing here?
Yeah, most of the time actually, especially when the pharmacist would tell me to say something like in terms of how often to take it or if it was new and what to educate the customer on. And then the usually elderly person would not not agree or not listen to what I was saying. And then the pharmacist would come down and say exactly the same thing. And it's just like, well, I told you, but obviously you can't say that. But yes.
Did you feel like they weren't listening to you?
Yeah, a lot of the time. Yep.
You moved from Bundaberg to Brisbane. Was that a scary leap?
A little bit. It was scary. However, it was something that I'd wanted to do for ages, or I could not wait to leave Bundaberg. I didn't want to be in a small town anymore. I wanted to go night clubbing. I think there was one nightclub in Bundaberg and everybody went there and it was just the same old stuff every weekend. And I just couldn't wait to get out and live my best 18-year-old life.
Now, you spent your adult life being the voice for the patients. What's that like?
I love talking to people, as a lot of our patients would agree with. It's just nice to be able to reassure people and give people the confidence. Like, I couldn't imagine anything scarier than walking into a specialist practice, not knowing what I guess is going to happen behind the closed doors in terms of like you've had a shoulder condition or it's been sore for however many years and you're about to find out what's happening. And a lot of people come in nervous, not wanting to talk, or then they walk into your office and then come out like a totally different person. It's just like 10 kilos have been lifted off their shoulders and they're like, oh, I'm not crazy after all, or oh, it can be fixed. So seeing that change in people and then being able to have the conversation with them afterwards. And then if they need to have an operation when they come back and getting to know them, a lot of people really love being able to talk about like what they do because we do see a lot of regional people and a lot of them come from like farms and that kind of stuff. So it's just really nice to get to know people.
I think that medical secretaries typically have a thought of as being a bit sort of standoffish and a bit difficult.
Yes, I have noticed that, I guess, when I've been a patient in some places. And I do feel like there is a really big difference in when you can tell whether someone wants to be at work or they don't. Like they're either happy to have a conversation with you or just generally can't wait for you to not be standing in front of them. And it's just like, shut up, go and sit down kind of thing. Or the people that actually care about their job and they're willing to not make great amounts of conversation, but you can just tell that they're genuine and that they do want to be there. But yeah, there can be some very, I guess, cold people and you're like, okay, yep, no problem. You don't want to be here. Neither do I. Let's get this over.
I think a lot of people are anxious about the whole thing.
Yeah, but also like if you're a medical secretary, I feel like that's your job to try and calm the whole situation from the get-go. Not everyone's going to be coming in here skipping and laughing. Like that's not what people do when they have pain or like sore joints or whatever. But you also need to be kind and caring rather than cold and shut off. And it also speaks a lot like when you walk into a reception area, you're like, oh, okay, well, if the reception staff are like this, the doctor must be horrible as well, like if they don't want to be here. So I think it also really sets the tone for the office when you walk in, someone's not as pleasant to speak to and you're like, oh, okay, cool. And then the doctor's got to try and rein that all back and give you confidence. And then whereas if you walked into somewhere and then the reception staff were nice and it's like, oh, doctor must be an all right person. And then they go in, do the thing, come out, and then it's just like, oh, this is a nice place.
You have this real gift for people, putting people at ease, and this in a difficult circumstance. Did that come naturally, or did you learn that?
I think it just comes down to being a nice person. Like I don't think it's hard to be nice, but I guess some people prove that wrong. However, I just feel like I am a calming, well, not always calming, but calm towards people. And I just don't like to see people upset or feel uncertain or unsure about anything. Yeah. And usually if I feel like someone's a little bit more anxious, like I try a little bit harder, I'm like, I just need them to smile.
What about those people you just can't quite get to smile?
I get really frustrated because I'm like, damn it. I'm like, just smile. But usually there's a reason why they're unhappy or a bit shut off or that kind of thing, which is valid. You can't be 1,000% all of the time.
Yeah. Is there a patient interaction you have never forgotten that's stuck in your mind?
Yeah, when I worked at Mater Hospital, actually, I was working in the specialist outpatient clinic and it was an orthopaedic clinic. So a lot of the people that come in have been on the wait list forever and they're really annoyed and all of the clinics are jam-packed. So like they're so overbooked and that's just the public health system. But this gentleman had come up to the counter and on their patient letter that they would get with the time and date of their appointment, it would say on there to allow at least 2 hours minimum for your appointment. So this gentleman, I think he'd been waiting 2.5 hours, which I get is such a long time. But I also think it's quite a privilege to live in a country where we have a public health system where you can just wait on a list and see a specialist and not have to pay anything. So in my opinion, I'm just like, just sit there and be grateful someone's happy to look at whatever's going on. And he came up and he's like, this is ridiculous. I don't know how long I need to sit here and wait. I've been waiting 2.5 hours. And I said, oh, no problem. Like, I can find out how far behind we're running. And he's like, well, what, don't you know? And I said, no, I'm just a reception staff here. And there was a doctor standing beside me. And he'd been at MARTA for a very long time. And he said, well, no, she's not just a receptionist. He's like, because I sure as hell wouldn't be sitting at the desk doing her job. He's like, they're the reception staff. They have their role. We're the doctors and the consultants. We have our role. And the doctor came and stood beside me and he said, here's the complaints number, pushed the complaints form to the patient, and he said, and I suggest if you have a complaint, call them. If you're happy to wait, sit down. Otherwise, happily see yourself out of here. So
Right.
the gentleman sat back down and I was like, oh, well, that worked out well, didn't it? And he was quite aggressive and quite abrupt. And all of the waiting room were looking at him. And I'm just like, okay, cool. And they were looking at me and I'm thinking, I'm just telling him what we've been told to say and that there's nothing really we can do. Like, obviously, you don't have any control over how fast a doctor sees a patient. There could be urgent cases that have been squeezed into clinic, which then they become the priority. But I guess everyone's their own priority in their own mind, which you absolutely should be. But in terms of waiting and getting frustrated and that kind of thing, it was nice to see him probably realize what he was saying and that he was being quite rude and it was out of our control, and that he just had to sit down and be patient. And I just remember seeing him looking at me, looking at the doctor that was standing beside me, and turned around and went to sit back down, and all of these people were looking at him. And I'm like, oh, I bet he just wants to just hide.
Yeah.
There's been some interesting interactions, but
Why did that one resonate with you?
mainly because he was quite aggressive, and I guess responded in a calm manner. I didn't accelerate his aggression, like I wasn't angry towards him back. And it's hard to be angry at someone when they're not
Being angry at you.
yeah, reciprocating the anger. And it was really hard for
So
him
true.
to continue to be angry. And
Yeah,
then,
right.
Yeah, and then he
I get it.
realised, like,
So you actually
Oh.
saw him change from being angry to sort of accepting the situation
yeah, and
and rethinking
probably really
things.
thinking about, oh, I'm probably making a bit of a dick of myself. I might go and sit down.
Do you carry any of this home when you leave the office?
Yes, I try and make everybody happy around the home, but having an almost 4-year-old is not always achievable. I guess the happiness can be quite short, especially when she's tired when I get home and she's really happy and then she's not happy. And then it can get a little bit hostile. Her and I are very similar. So we do butt heads, but I do try and, like, I guess, over exaggerate the kindness because I'm like, I just want everybody to be happy. But no one can control a toddler.
Yeah. Now, most people your age have changed careers multiple times. You didn't do that. You went deeper into healthcare. You went from pharmacy to medical reception to working for me. How does that work for you?
Well, when I started in pharmacy, I was a pharmacy assistant and then I worked full time, and then I moved to Brisbane and then ended up moving back to Bundaberg, and I got my dispensary certificate. So I was able to dispense medication, which I thought was pretty cool. And then I ended up managing a pharmacy after I moved back to Brisbane at Mount Omni, and then I went back to being a dispense tech, and I was starting to realize that being a dispense tech was kind of like a dying job because a lot of the pharmacies are nowhere near as busy as they used to be, and especially with like the bigger pharmacies and discount pharmacies coming out, they were mainly wanting just pharmacists. And I thought to myself, well, I need to do something else. Like, I'm not going to be a pharmacist. And I've always thought to myself, if someone's studying pharmacy, they may as well study to be a medical doctor, because all of the chemistry, and there's a lot of subjects that do cross over. And I have also seen, since I've left pharmacy, a lot of pharmacists I work with have become doctors now. But yeah, I just thought, I'm not going to be a pharmacist. I don't want to manage a pharmacy. It's not my thing. And then I remembered that I was like, what else could I do in the healthcare sector that isn't pharmacy? And I thought I would try my hand at a medical receptionist job. I do always remember the ladies that worked at the GP clinic when I was little. They were always so lovely. And I'm like, oh, I just want to be that nice person. So it was actually really hard to get into, because a lot of places wanted someone that had experience. And I had customer service experience, but that was it. So I did try for a while to get into medical admin, but yeah, finally someone gave me a go, and yeah, here we are.
Loyalty is a word I would use to describe you. Where does that come from?
I like stability. So I know that I wouldn't say it's easy coming to work every day. I would love not to have to work, but here we are. And it's also nice to have a great work environment. I guess I've tried my whole working career to have a half decent boss, and I've come across one, and I do like to try my best, because I guess everything's twofold. Like, if you be nice to people, people are going to be nice back to you. And I just like coming here every day. Well, 5 days a week.
Or work on the weekends.
Yeah, not yet. I'm sure there's the capacity.
What does it feel like when a doctor genuinely trusts you to look after his patients?
I feel like it's a lot of responsibility, especially for someone like the specialists that we deal with. They're very experienced in what they do. They know what they're talking about, and they are trusting in someone, especially if I need to phone a doctor or something from here. They're very trusting in someone that they don't know regarding someone's health, and that's huge.
Yeah.
But it feels really nice.
Yeah, right.
Yeah.
Cool.
But it's huge responsibility.
When you're talking to someone on the phone, you're booking surgery, something they're anxious about, how do you make them feel genuinely cared for across the phone?
When you're on the phone to someone, I guess it is easy to talk to someone when they're forthcoming with information, which is helpful, but also you can tell when someone's not listening to you. You can tell when someone's not listening to you on the other end of the phone. You can tell when they're distracted. And I feel like you can tell when they're genuinely interested, and you get more out of people when they feel like they're being heard, which is super important, especially when someone's calling and then you're the first point of contact for the clinic. Like, you need to be kind, you need to be approachable, and when you're asking questions, you need to, I guess, not dig too deep, but you need to find out essentially why they're coming. And it is important to be kind on the phone. I feel like you can hear when someone's smiling at you.
So you think of that smiling at them over the phone?
Yes.
And hearing them?
Yeah, and listening.
Actually listening to them?
Yes, which is hard, especially when we're answering phones and it's on a clinic day and all of the things are happening, or you're standing behind me trying to tell me something, and I'm like, I'm on the phone, and you're like, that's fine, but I need you to listen. But it's a lot easier when it's a little bit calmer on a non-clinic day, but I guess that's where multitasking comes into play.
Yeah. Tell me about a time you've had to deal with someone really angry. There must be someone that is in that comes to mind.
That comes to mind when I'd probably been working in pharmacy for a couple of weeks, and this was when pseudoephedrine, you just had to give your driver's license over, and codeine still came in the cold and flu tablets, and you would get the serial people that would come in every Thursday night just before you close. So it was like 8:30, and these people walk in and pretend they're unwell, or they come in with someone else's driver's license, which is really interesting. And you tell them that you can't give it to them because the symptoms they've described to you don't warrant pharmacist intervention, and then therefore putting a label on a box essentially. And this lady was so angry because I had taken her driver's license, went up, spoke to the pharmacist. He said, oh, it's a little bit iffy. And he said, I feel like I've seen her before though. And we started to dispense the medication, and before we popped her driver's license in through the program that we used at the time, I believe that doesn't exist anymore because there are other Australia-wide programs, but he dispensed the medication and she'd been into the pharmacy a couple of days prior for the same thing. And I think the box of cold and flu tablets lasts like 4 days if you take them regularly, and it had only been 2 days since she'd been in. So 16-year-old me had to go down and tell her that I'm really sorry, unfortunately we can't give it to you. And she was ropeable. Anyway, she slapped the desk. I remember she snatched her driver's license back and she just walked arms out down the first aid aisle with all of the individual dressings. You know how like you get them in the pack and...
Yeah.
Anyway, so they come in like a thing in the pharmacy and they're all individual there. At that time, they were just sitting on the shelf. You didn't have like the self-dispensing things. And she just walked arms out down the first aid aisle and just knocked every single one over. So I think there was like thousands of dressings all over the ground. And I'm just like...
This is before closing on Thursday night.
Yep. I think it was like 8:45 on a Thursday night. And I just turned around and looked at the pharmacist and he was just like, oh my gosh. So we just picked them all up and put them in a pile. And until the Saturday rolled around, if people needed dressings, we just had to go through the shopping bag and find what they needed because that was a lot of sorting. That has always stuck in my mind. I was just like, she must be so angry. And she's thinking, how can I ruin this girl's night? And yet arms stretched, just walked. And she just didn't even look back.
Yeah.
But
she knew what she was doing.
Yeah, they're the characters that come in at 8:30 on a Thursday night.
Tell me, what was the hardest point in your career?
I think the hardest point in my career, in my medical secretary career, was when I first started coming to work for you. No one knew I was coming. I was a temp. I started off as a temp, and one of the recruitment agency ladies had contacted yourself and you're like, yep, sure, that's fine, bring her in. And I came in and one of the girls who knew I was starting hadn't started yet. Two of the other girls walked in and they were like, oh, hi, who are you? And I'm like, oh, hi, I'm Terri-Lyn. I'm coming to work with you, sorry. I'm coming to work for Ken. And they were like, oh, okay, cool, sit down. And that was that. That was it. And then I was just on the job training and it was very much sink or swim, but I feel like I definitely swam.
I think we've improved things since then.
Absolutely. Things have changed a lot.
Yeah.
But it was great. I think also when you first walked in for the first time, I was like, oh, hi.
Is there anything you wish you'd done differently?
No.
Over the years?
Oh, actually, no, that's not true. There is. When I wanted to be a paramedic when I left high school.
Yeah.
And I did revisit that at one point a number of years ago. And when I first left high school, because that was in 2008, being a paramedic was just like you'd go to the ambulance station, do the bookwork there and learn on the job. But now it's a university course. And I really don't see myself going to university again. No.
How long is the course? Is it 3 years or 4?
3 or 4 years, yeah.
Right.
So paramedic science.
Yep.
Which I can understand it being a university degree, but I guess a lot of things
it's completely changed. They do a lot of stuff for people now.
Yep. Very much so. A lot of administering.
It's no longer, scoop and scoot.
No. that's
They're saving people's
gone
lives
are the days.
on the pointy end.
Yeah, absolutely.
Yeah. If there's a young person out there who's just thinking of starting an medical admin, what advice would you give them?
Do it. Don't be scared. Doctors aren't that scary. They're nice people. They're just like you and I. They just have more hours in the day that we do somehow. I think that everyone should give it a go, especially if you like talking to people. I guess if you're not really a people person, don't do a customer-faced role. But if you like talking to people, being the first point of contact, like being on the phone, and have a little bit of confidence in terms of talking to people when you feel like they may be like smarter or more educated or at a different level in their life than you. That I was always told that it doesn't matter who you are, you should always be nice to somebody, and we all go in the ground the same way, no matter who we are or anything like that. So I think if you've got confidence in yourself, that I think medical admin is a great job, especially when doctors are asking you to do things and you're not really sure what they're asking about.
Yes, you're the person I turn to if I need to talk to a patient, I can't get there. There's something going on, it needs to be explained, and things have changed. You have this wonderful ability. I know that I can send you down to the ward to talk to one of my patients, and everything will be fine. Whereas it's possible to send someone to the patient, it just goes completely confused,
Yes,
and creates so much anxiety in that person.
yeah,
And you have this wonderful ability to do exactly that, not fully knowing the whole scheme of things,
yeah,
but you're able to take what I give you and transmit that to the patient with confidence and put them at ease,
yeah.
which I think is a wonderful skill.
Yes, it is. Does feel like it's a nice skill to have. It's definitely something I have developed over the years. I think when I first started, if you asked me to do that, I would have been like, absolutely not. But now I think it's great. I love going down to the ward. The nurses are also super lovely here.
Yeah, they're great.
Yeah,
They really
they're so
are.
good. But I think it's also when you're going in to tell a patient someone, you need to tell them in confidence, because they're either waking up from anesthetic or they're a day post anesthetic. They're very unsure, and if you're going in not really certain about what you're talking about, they're probably not really going to listen nor feel confident in the information that you're providing.
Yeah.
Which is also helpful when yourself is very forthcoming with information in terms of educating us, so as that it gives us confidence when we are talking to people that we are certain of what we're saying because of 3 steps prior.
What tips would you give to someone who's struggling with that ability to connect with people? You mentioned when you're talking to people on the phone to smile down the phone and actually listen to them. What's it like in person? Is it the same thing, same dynamic?
Yeah, I think so, that you need to devote all of your attention to the person in front of you. I'm a very distracted person, but I do remind myself that the person in front of you is the priority, and that you are talking to them, and that if there's anything happening around you, that those people aren't the priority. The person in front of you is the priority, and you need to give them all of your attention, because they're also not going to feel heard.
Yeah.
And I've learned, especially from working here, that people like to be listened to. It's
People
also
want to be heard.
Yeah, they do. It's also nice to know that when you're talking to someone, it's not just landing on deaf ears.
Yeah.
That someone is listening.
Yeah, you mean when they're talking to you.
Yeah, or it's just going straight over your head or in one ear and out the other.
And it's the difference when you pay attention. It makes such a difference to that patient talking to you.
Yes. Yep.
Yes. I remember, I think of when we're doing patient phone calls and you're sitting with me, taking notes while I'm talking to people, I will sometimes get distracted by some message coming through, say from the ward or something I've got to attend to.
Yeah.
And you're like, Ken,
hello.
Hello.
Yeah.
I've got to pay attention.
Focus.
Yeah, exactly.
Tap on the desk.
And it is so important. What do you want people to know about the work the medical secretaries do?
I feel like it's not just sitting on my bum all day.
Is there something that you think they don't see?
I think the assumption also is that if you're not here, we're not doing anything. But it still blows me away how much work you create.
Oh, yeah.
One person can create so much work that will keep us going for 2 weeks while you're not here. And people assume because Ken's away that the girls are on.
Do they?
Yeah.
Oh, I don't.
No, I know.
I know what I create for you guys.
Make sure there's lots of things to do.
Yeah.
I think they think because you're not here that there's nothing going on. But there's a lot going on that you don't see from the other side of the computer monitor.
Yeah. So at the end of the day, when everything's gone right and you've connected with everyone,
yes.
What does that feel like? Is that, is there a feeling that you get that makes you keep wanting to come back to work?
I feel humbled. Like, it's just nice to see people leave happy. And I guess not everyone leaves happy because it's not a perfect world and you don't have a magic wand, unbelievably to some people. But I think it's nice to know also when things don't go the way we plan, that we don't just kick them to the gutter. Like you will be looked after. We will try and make this right, and that it is important, again, that those people don't feel alone because in the world of medical, not everything's textbook, despite all of the textbooks.
People are not robots.
Yeah, exactly. But I think it's also comforting when something does go not to plan, that there is someone that is knowledgeable enough to be able to work out what didn't go to plan and rectify it, rather than be like, oh, sorry, that sucks.
Yeah. And on those days when everything goes right?
It's just nice to go home and have a nice dinner and leave smiling. But in the world of shoulder surgery and a shoulder surgery clinic, that doesn't always happen, especially when there's an ad on to the theatre list for Monday at 4:15 on a Friday and the patient lives remotely.
Which I think I did to you last week.
Yeah, yep, which was a lot.
Yeah, but you guys certainly cope with it admirably.
Yeah. Well, we don't really have a choice, but we do make it work. It's nice that we have, I guess, yourself that is so supportive when it does come to that kind of thing. You're not just, oh, this person needs an operation. You work it out. Like, this person needs an operation. I've done X, Y, Z. Let me know if you need anything else.
Yep.
Which is really lovely when you know that the office closes at 4:30. It is a Friday. And the last thing that we want to be doing is working back, but we will do what we need to do to make everything go smoothly for the Monday morning.
Yeah, for those patients.
Yeah.
Yeah, pretty cool. Terri-Lyn, thank you for coming on today and talking to me.
You're very welcome. It's been I want to say a long time coming, but not really in terms of me being on the socials.
Wonderful talking to you.
Likewise. Thanks for having me.
You've been listening to Inside the Shoulder. I'm Kenneth Cutbush and I've been talking to Terri-Lyn Bailey. Terri-Lyn is one of those people that has this tremendous ability to put people who are anxious and uptight at ease and feel calm. Terri-Lyn, thank you for coming in and talking to me.
You're very welcome. Thank you for having me.
If you've enjoyed this episode, please like, share and subscribe to your favourite podcast channel. Thank you for listening.